Now it's time for On Point, where we speak to experts to delve deeper into some of the key issues in the spotlight right now. Now, some countries that saw a huge decline in the number of COVID-19 infections are seeing another resurgence in daily COVID-19 cases again, the U.S. being one of those countries.
So what went wrong in those countries, and could this be a premonition of what's to come for other countries moving forward? For this, we connect with Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Very good morning to you, Professor. Now, first off, let's go to the US. The country is seeing a massive resurgence in cases, and although the actual figure could be higher considering much less testing is being done, what do you think is behind this resurgence, and what do you think went wrong?
Well, they had a lot of BA1 a few months ago, and now they're dealing with Omicron BA2.12.1, which is a little bit different. And so there's people in the US who maybe don't have immunity to this particular strain. But while the cases are going up a lot, the severe cases, the case of severe COVID, are not actually going up that much, which is very reassuring. That's because of the immunity that's been built up from the high vaccine coverage and also the high number of prior infections, unfortunately. So it is not so much of a concern anymore. And I think this is what the situation will be like going forward, that we'll have infections in different places at different times, but there won't be so many severe cases anymore.
I want to kind of take a look at a report that came out recently. If you look at, for example, New York City, right? It's one of the U.S. cities that's seeing a high number of cases popping up again. Still, New York City Mayor Eric Adams saying that he won't be reimposing mask mandates. Now, there are people who say masks are pretty much useless against the Omicron variants. What's your assessment on masks against the Omicron variant?
Well, Omicron is highly transmissible. Masks certainly do work, but they're not perfect. They can reduce the transmission to a certain extent, not by a lot. So around the world in the last 2 years, a lot of places have had mask mandates. But now that countries are aiming to go more towards normal, I think it makes a lot of sense to have a recommendation that people consider wearing masks, but no longer to make it a mandate. It's not always easy to force people to do things that they don't want to do. And I think you have to use that power sparingly. So it does make sense to me that they're not bringing back the mask mandate, but the recommendation is still there, of course, and people can wear masks if they want to.
And Professor, a bit concerning news really. World Health Organization panel assessed that the world's governments are no better prepared to address the pandemic now than they were back in 2020. So what really are the issues and what needs to be done?
Well, I think right now and for the next 12 months or maybe the next 2 years, it's a really good opportunity to look back at the experiences from the COVID pandemic and update the pandemic plans for the next time round based on the experience gained during the COVID pandemic. Health departments have been too busy in the last 2 years to think about the future, but now is a really good time to reflect and then to make better plans so that we can respond better the next time there's a pandemic, whether it's coronavirus again, influenza, or something else.
Professor, we also want to kind of get your take on North Korea as well. They refused any help from the very start of the pandemic, though we don't have the actual figures. Still skeptical that the numbers that they're giving us is actually real. But I'm sure North Korea must have one of the lowest vaccination rates in the world, not to mention we're now seeing reports that there are massive spreads amongst its military, which could be concerning for them. Is it too late for them, or should they still try to vaccinate as many people as possible?
It's never too late because we know vaccines can have an effect almost immediately. Even the first dose can have an effect almost immediately. But it is getting towards the point when it's going to be too late because we know how fast Omicron spreads. Their peak must be approaching if it's not already here. And so that means that really the pressure on their healthcare system is going to be phenomenal at present and in the coming few weeks. It's really an unfortunate situation because vaccines have been available around the world for more than a year now. And we know that's critical to protecting older people against severe COVID.
And we're getting so many different subvariants of Omicron. Why is it evolving so quickly? And is this the future that we're going to be seeing continuously now?
That's a good question. It's not clear what exactly is going on because the virus does seem to be evolving faster than expected. In general, coronaviruses do not evolve that fast, but COVID has been changing quite rapidly. With Omicron, there's been a lot of infections around the world, and when the virus has more opportunities to make small changes. That's when it might be able to make those small changes and then find ways to escape the immunity that's been building up in populations. But that's really an active area of research for many people around the world, trying to figure out what's been happening with Omicron and what might be going to happen in the future. How much further could the virus evolve? Will it continue to evolve this fast, and so on? So let's really keep a close eye on that.
Because the other big question is, of course, what comes potentially after the Omicron variant as well, right? Well, thank you, Professor, for your insights this morning. Looking forward to speaking to you again next week.
Thank you.